Hello, Sierra Nevadans. Dr. Evans here with some COVID updates for all of you. That's kind of what's on my mind right now. First of all, there's definitely some interesting things happening with the vaccines that are coming out. We expect that the FDA is very likely to give emergency use authorization to Pfizer for its vaccine, and that's the one that we're probably going to have access to first, but there's several others that are on the way. I do want to let you know that our own internal experts in CommonSpirit Health, people who have expertise in vaccines, infectious diseases, and other things, are evaluating the data themselves. So we're going to be able to look at all this and really scrutinize it. And then once we're very comfortable, we'll be recommending the vaccines as appropriate after that. Our numbers here at Sierra Nevada remain stable. We've had, at least at the hospital, our hospitalized patient numbers have remained stable. We're certainly seeing a lot of patients out in the community who are testing positive. We've seen quite a few in the emergency department, many of whom have been able to go home and recover from COVID-19 there. And fortunately, we've been able to keep, like I say, the hospital numbers down so that we have not been overwhelmed at this point. But we are a little concerned about staffing, as I've mentioned in previous videos, and we certainly want to make sure that we're able to continue to take care of all these patients effectively. Part of that depends upon our own staff not getting COVID-19, and all of you can do your part with that by really limiting the spread through all the things we talked about before: mask wearing, social distancing, etc. Other hospitals in the division have really gone up in the number of hospitalized patients, including our Sacramento partners down the hill. And other areas are really starting to become significantly impacted. Places like Los Angeles, San Joaquin County, and the entire state of Nevada is really experiencing quite a surge. So we all just really need to step up and make sure that we limit the spread. If you are having a medical issue unrelated to COVID-19, I do want to let you know that you should still seek an evaluation, either through your primary doctor. Certainly if you have an emergency medical condition, you should come into the emergency department. We're taking all the precautions we can to really reduce the possibility of any sort of COVID exposure. And it's definitely important that people get whatever their symptoms are, if they have emergency symptoms, checked out in a timely way, because we don't want people deferring care and having problems as a result of that. The other thing I'll just say is it's good for our own mental health to get outside. Right now the weather has allowed for that. It's a little cool at times, but the sun has been out, and it's really good for our mental health to breathe some fresh air. And if you're just by yourself outside, that's great. If you're with your household contact, that's okay. We don't want gatherings even outside, but now's the time to really make sure that we're mentally healthy and strong for the rest of this winter. We do have an end in sight here with these vaccines, and let's just be careful as we get to it. So thank you very much. I appreciate it. We'll do another update next week.